on Friday afternoon, late on Friday, Novo Nordisk got approval for Wegovy, which is its weight loss drug to treat a liver disease called MASH. And this sort of is we've seen over the last couple of years so many studies come out to show the potential health benefits of these weight loss drugs beyond just reducing the number on the scale. And we knew from studies that there was some benefit to the liver from taking these drugs. And so Novo was able to notch an approval for that, which helps one with insurance coverage. Wegovy and then Eli Lilly's drug Zepbound are still not super widely covered by insurance companies for weight loss, but having some of these other health benefits shown and proven in studies helps them convince insurers that they are worth covering. And so this gives them an edge against Lilly. Lilly's drug Zepbound is not approved yet for this indication. And so it gives them sort of a leg up there. And then it also gets, it sort of is another benefit for Novo because they've been struggling over the last year, just with Zepbound sort of making waves in the market and taking market share from Wegovy. This gives them a leg up there as well. And just with the tumultuousness of the last few weeks, they had a CEO ouster and a few other moving pieces. So this is good news for them, and we'll see. But it will maybe help them gain back some market share.
Again, one of the issues for these weight loss drugs is the cost. And if you're not covered by insurance, they really are expensive. So by slashing the cost of Ozempic in half, does the company believe that's going to open up a big new vein of new customers maybe?
So it's interesting because if patients are on Ozempic, they are usually on it. It's a type 2 diabetes treatment, and usually that's covered by insurance.
Type 2 diabetes, but does it have a side benefit, I guess, of weight loss?
Yes. So, there are two different drugs, right? There's Ozempic, which is the diabetes drug, Wegovy. They both use the exact same active ingredient, which is semaglutide. Okay. Wegovy is a higher dose version. If you're on Ozempic, it's lower doses. Okay. So it's not quite as strong. But there is that weight loss side effect on both drugs. Previously, Novo actually did cut the cost of Wegovy down to about the same price, $500 a month, back in March. And now they are doing the same for Ozempic. But it's interesting because the question of whether or not this is going to expand access for more patients sort of remains to be seen because, again, if you have Ozempic, you usually are covered by insurance for it.
Now, something I also said, they're partnering in this article. It said with GoodRx to offer Ozempic Wegovy for the same price at pharmacies. But didn't Novo try the partnership thing with Hims and Hers, and that didn't work out so well?
Yeah. So Hims was one of several partners that Novo has sort of worked with over the last couple of months, again, to really make waves and get into this market or gain back market share because it's really lost ground to Eli Lilly. Hims was one of the companies that they partnered with. They've partnered with a couple of other telehealth companies, as well as CVS, to make this cash pay price more widely available. But this is the first time that they're dropping the price of Ozempic as well. So this partnership with GoodRx, any patient is essentially a coupon. Like any patient who goes to a pharmacy uses GoodRx is going to be able to get this cash pay price for Ozempic and Wegovy.
Mention the Hims and Hers, those compound drugs. How effective are they vis-a-vis the GLP-1s themselves? Because that would be if I were like Novo Nordisk, I spent all this money to develop it, that would be a bummer to see these guys come out.
And that's a really good question, actually, that question of how effective are these drugs, because that's the problem is we don't know. There are studies that drug makers are required to do. They have to go through a lengthy FDA approval process to prove that their medications are safe and effective. Compounded drugs don't go through that same approval process. So there's no actual studies showing how effective those medications are. And it's a little bit of a gamble. We've seen patients losing weight on these compounded medications, and we haven't seen a tremendous amount of side effects that are really different from the branded medications. So the problem is just more that we don't actually have a lot of visibility into that compounded market and don't know how those drugs stack up to the branded medications.